Hi there. This is Mark Idelman, speech-language pathologist and author of The Teaching of Talking and soon to be released video training course for people with aphasia, and that's going to be geared to speech-language pathologists and caregivers. Anyway, the topic of this particular short blog today is entitled, "My Husband is Not Disordered." You heard me. My husband is not disordered. And you might go, "Well, Mark, what the heck are you doing? Why are you saying this?" Well, I just wanted to share this with you because a number of years ago, I worked at a large rehabilitation hospital and saw lots of patients each and every day. And one day I was working with a gentleman and his wife. He had aphasia, and I referred to his speaking difficulty as a speech disorder. And I probably said the word speech disorder a few times. Well, if we think of the word disorder, Webster would give us some information about that. And some of the words that he compares to the word disorder is confuse, deranged, disarranged, disarray, discompose, dishevel, disjoint, dislocate, disorganize, disrupt, disturb, hash, jumble, mess up, mix up, muddle, muss, rumple, scamble or scramble, shuffle, tumble, upset, or tussle. Now that sounds like right out of Henry Higgins' My Fair Lady. But if we look at those words and listen to those words, the connotation of those words is very, very, very negative. And so when I referred to her husband and said that he had a speech disorder, you know what she said to me? She said, "My husband is not disordered." And I thought about that for a few minutes. And that statement stayed with me all day because she was quite distraught about that. I mean, she was saying, "My husband is not disordered. My husband just has aphasia. You shouldn't talk like that, that he's disordered." And I thought and thought and thought about it. And from that time on, I decided that day that I was going to, when I referred to people who had a speech disorder, which I was taking out of my vocabulary, the verbiage that I decided to use was speaking difficulty. So now, if you'll see, throughout most of my writings, I refer to many different kinds of speaking difficulties. And that's such a better feel to it, a better sound to it, a better connotation, speaking difficulty. So I think the woman who politely corrected me about her husband was able to say something that probably many people think, but just rarely state. Or maybe they're really afraid to state that. Or maybe a loved one or a caregiver, when they heard a speech pathologist or someone say, he has a speech disorder, that probably doesn't make them feel that good. And I think it's very important in today's market, especially the healthcare market, that we use words that people don't take offense with. So that's why I choose to use the term speaking difficulty. Thank you. This is Mark Idelman, speech-language pathologist, author of The Teaching of Talking and the soon-to-be-released Teaching of Talking video training course for caregivers and speech pathologists. Thank you very much.